And hello, it's Friday, and that means it's time for our Facebook Live. And so we kind of do a little sound check real quick. Trace, you getting that for me? Doing a sound check? We're going to see if you can hear me. If you can hear me, go ahead and say yes. Oh, it looks like somebody can hear me. Alva, is that you? It looked like your little face there. Okay, so we're going to just imagine that you can hear me. So when I posted this week on our Facebook page, thanks, Ray. Appreciate you. Thanks for letting me know you can hear me. We posted on Facebook about mammograms, and a surgeon has come out and said that the mammograms are outdated, the data is outdated. So I want to read some things for you, so we'll just see where we are. Okay, so the public has been told that mammograms are the only way to catch breast cancer early. But in review of 8 scientific trials evaluating the procedure, they found that mammography is neither effective nor safe. After looking at data on more than 600,000 women between the ages of 39 and 74 who underwent the procedure on a regular basis, researchers found that the women are misdiagnosed. Okay? Many of these same women are consequently then mistreated with chemotherapy. Is that the dental? Yeah. It's imprinted. Thank you. Sorry, it is live. We have patients here, and we had a question, so all that's good. Tracy, will you go ahead and mark that for me? Thank you. Thank you. Okay, so mistreated with chemotherapy. So imagine being told that you had a mammogram that was showing a problem. So you go, they put you in the cancer treatment protocol, and so you're having surgery, possibly you're having radiation and chemotherapy, which you didn't need, right? So that's a very toxic thing. So this is not Dr. Google. These are really, really sound research papers. So I'm going to give you some information. As published in the Cochrane Database of Systemic Reviews, right? The review stated that mammography caused more harm than good because many more women end up being misdiagnosed, mistreated than those who actually avoided the development of terminal breast cancer, right? Thus, the procedure known as mammogram is outdated and belongs in the history books of failed medical treatment. Now, that's a really strong thing. It's a failed medical treatment, and yet when you look at any kind of social media or you look at, advertisements on the television, they're saying go and get your mammogram. There are all kinds of programs, nonprofit programs that give mammograms to women who are underprivileged, can't afford them. And so it's really a problem in our society because these doctors are saying, wait, this does more harm than good. So here are some assumptions. If we assume that screening reduces breast cancer mortality to 15% and that overdiagnosis and overtreatment is 30%, then that means for every 2,000 women invited for screening throughout the 10 years, only one will avoid dying of breast cancer, and 10 healthy women, right, would not have been misdiagnosed, right? So that means this is unnecessary, right? So in the New England Journal of Medicine, it came to a similar conclusion. The medical team says that, and this was a team of a medical ethics, a clinical epidemiologist, a pharmacologist, and an oncologic surgeon. So this is a doctor who specializes in the removal of cancer, right? A nurse scientist, a lawyer, and a health economist, right? They all decided that the medical industry claims about the benefits of mammography are essentially bunk. That's a direct quote, right? This was in the New England Medical Journal. So you would think that if this is in the New England Medical Journal, then the doctors would quit doing it. But no, they don't. Okay? So, further finding. They found that for every 1,000 women screened in the United States over a 10-year annual screening period, beginning at age 50, one breast cancer death would have been prevented, while a shocking 490 to 670 women would have had a false positive. Okay? So, a false positive. 70 to 100 women would undergo unnecessary biopsy. Between 3 and 14 of this women, the study found, would also have been overdiagnosed for non-malignant form of cancer that never would have ever been clinically apparent. So this is the New England Medical Journal, okay? So this is not Dr. Google. This is a very credible source. There was a study out of Switzerland that also corroborates the study, and there was also one out of Canada. So in 2014, the Canadian National Breast Screening Study concluded in lockstep with the others that mammography screenings do not reduce the mortality rates from breast cancer any better than a simple physical examination. In other words, the procedure is completely unnecessary and in many cases exceptionally harmful. Now, there's all kinds of cartoons and that kind of thing with women, undergoing the mammography, the mammograms, and then you've seen a car with a tire rolling over the breast because of the heavy pressure that is applied to that. So it's very painful and it is actually harmful. So there was another study out of Norway, right, confirming that mammography isn't all that it's cracked up to be. The United States data spanning the course of nearly 40 years, right, shows that more women are over or misdiagnosed with breast cancer because of mammograms than are successfully early diagnosed with breast cancer and other ways to protect against metastasization. That's a big word. I don't know that I can say that very well. Bye-bye, guys. Thank you so much. Have a safe trip back. Bless you. Bye-bye. All right, so this represents an exceptionally poor track record that calls into question why mammography continues to be used when it clearly doesn't work. Now, this is a doctor, right? She says, and this is a quote, "I believe that if you did have a tumor, the last thing you would want to do is crush that tumor between two plates because that would spread it," says general practitioner Dr. Sarah Mybill, who was quoted in the documentary film The Promise. So here you have a report, right, and we've posted this on our webpage, but we'll repost it if you can find it. I think I maybe have posted it on my page, Trish, so if you could go to my page and then just post it to Abundant Health and Wellness, and that way you'll get it. And you can read the whole study for yourself. But this is what we have to do. We have to be our own best advocate. Now, I did have a mammogram about 10 years ago. I did not know what I know now. It wasn't extremely painful. I mean, I've heard that they are extremely, extremely painful. It wasn't all that painful, but it was uncomfortable. And then you're standing there and you're naked and you got this lady, fondling your breasts. I don't mean it in a sexual way, but I mean, she's pulling it and pushing it and all that. I mean, it's just not a comfortable thing. So if we don't have to do that, why would we choose to do that? It's because we've believed what the powers that be, whoever they are, whether it's the American Medical Association or just the cultural norms that says this is how you find breast cancer. So here at Abundant Health and Wellness, we do have an alternative, and it is called thermography. Now, I know we have somewhere around here, Trish, we've got a pamphlet that shows what a thermogram looks like. Do we have one of Angel's pamphlets? Maybe in this drawer down here? Maybe in that bottom drawer. We used to have them. Anyway, we have a clinician. She's extremely, very, very qualified. It won't be in that drawer, honey. It'll be in this drawer over here. on the bottom drawer. So if we still have some, we may not have some. But if you'll Google thermography, and we'll go ahead and we'll put Angel's contact information at the bottom of this. That's it. Do we have an inside? Yes, we do. Okay, so this is her pamphlet, okay? And what this shows is a thermal image of the breast. Don't worry about the writing. The writing is flipped because of it's a camera. So where you see in this picture over here, where you see all the red, that is inflammation. And you see red under here, well, this is underneath the breast. Now, just so you know, because if you've never had thermography, it's very, very private. We put you in a back office where you can just be back there with Angel. And what she'll do is she doesn't even look at you. She focuses a camera. So you're like in a hospital gown, you've taken your bra off, you can keep your panties on, but you've taken your bra off, you've got a hospital gown on. She turns away from you, just looks at the monitor so she's not staring at you. So that makes it a little bit more comfortable. And what she is seeing on the screen is this pixelated image or images of the breast. And what she'll have you do, she'll have you raise your arms, lower your arms, do all that kind of stuff. And so what she's doing is she's getting all kinds of pictures. Now, she's very, very qualified. Her camera beats the required specifications by the powers that be, whoever certifies thermography, okay? And also, another thing, that these images are not read by a radiographer. They are actually read by a medical doctor that is trained to work with thermography to be able to tell if there are any issues in the breast. Now, when I had mine done and Steve had his done, we did full body images, and of course the full body is going to be more expensive than just the breast. But I wanted to know, are there any pathologies in the thyroid? I wanted to know, are there any pathologies in the breast? I wanted to know, with the colon, are there any pathologies there? And so, while as all of our holistic techniques are not diagnostic, they certainly give us some indication that we've got a problem, and then we can go toward a more medical route if that's what we want to do. So I'm happy to say that Steve and I both had the full body, and we were all good. There were no problems. There was no alarm for me in the breast or the thyroid or the colon area. And Steve was the same. Of course, we're not looking necessarily breast with him, right? But we're looking for prostate issues. And yes, he does PSAs and that kind of thing. But you can have just the breast done if that's all that you're concerned about, or you can have total body, especially if you're older and the tissues are thinning. Then we would want to do a colonoscopy as the last resort, because there are instances where they perforate the bowel. Just as you get older, the bowel just gets thinner and thinner. All your tissues do. And that's why we get saggy as we get older, right? And so we want to be able to kind of work with that and not have that problem. So if you have any questions about mammograms, go ahead and do your research. Don't just look at social media, okay? Social media is good. It's social. But what I want you to do is look at the published, peer-reviewed studies. And as I said, we've got 8. I think I named 8 different studies here that proves that mammograms are not necessarily your best option. So, unfortunately, that is what your insurance is going to want to pay for. So if you do thermography, then what you're going to have to do is pay for it out of your own pocket. I'm hoping that with the new Healthcare Act that they'll be more inclusive to alternative therapies, but who knows? Don't know if that's going to happen or not. But it is an investment in you. It is an investment in your future. So this is what we do here at the clinic. This is what I'm going to do from here on out. Only going to do thermography, not going to do the mammograms anymore. So you decide what you want to do, and we'll see how we go. So want to kind of switch tracks here, and I want to talk about gut health. Okay, so your gut health has to do with your enzymes. It has to do with your digestion, and it also has to do with elimination. So we've got a new protocol that we want to offer to you, and it is called, I had paper here, let me see if I can find a paper. It is called Thrive in 63. What happened to my little paper? Oh, here it is. Yes. Thrive in 63. Now, what this is a 63-day protocol, right? And what it does, it has a meal plan, daily menu, food journal, supplements, and a shopping list, right? So that you can take this and see if you've got gut dysfunction. So, some of the symptoms that you have gut dysfunction are diarrhea, constipation, gas and bloating, inflammatory bowel disease, any kind of inflammatory bowel disease. So that would be gastritis, colitis, Crohn's, IBS, gluten intolerance, okay? A lot of us are gluten intolerant. Pancreatitis and hepatitis. Now, pancreatitis is something that's really important because when the pancreas is inflamed, the pancreas does not produce the enzymes, and it's the enzymes that we need in order for all of our metabolic functions to, in fact, functions. So if you have skin disorders, eczema, psoriasis, hives, or acne, then you probably have gut dysfunction as well. If you have musculoskeletal disorders, so that would be joint pain, muscle pain and weakness, fibromyalgia, chronic fatigue syndrome, or osteoarthritis, and that's something that also portends to gut dysfunction. So, also, neurological disorders, headaches, migraines, autism, depression, attention deficit, OCD, multiple sclerosis, Alzheimer's, and Parkinson's. So this really covers a lot of different symptoms here. What about cardiovascular disease? Atherosclerosis, arteriosclerosis, inflammation in the circulatory system leading to cardiovascular disease, high blood pressure, or elevated cholesterol. All of this is faulty gut metabolism, right? Immune disorders, any kind of autoimmune disease, so that would be rheumatoid arthritis, that would be Hashimoto's disease, that would be just a lot of different things. Lupus, hypersensitivity, chemical sensitivity, all that kind of thing. Hormone imbalances, PMS, a hysterectomy, thyroid disorders, adrenal fatigue, respiratory issues, asthma, sinus, nasal congestion, and then an inability to lose weight. So, if you want to do this, right, if you have any of those diseases or dysfunctions that are listed on that list that I just read, then you would be a great candidate for this new protocol. It's called Thrive in 63. Now, I was reading in this little book about it, about what actually happened when people did this. So their inflammatory markers came down, their body mass index came down. Now, your body mass index is your ratio of fat to lean tissue, right? And we know that anybody that has a waist, a woman that has a waist that's larger than 36 inches, maybe 34 inches, but right in that area. If your waist is larger than that, then you are a key candidate for some really serious diseases. So this protocol actually worked on that. Okay, so it's very, very good. All the products are good. They're clean. They're pure. They vibrate at a very, very high frequency, and so we like that. Now, I was going to see if I had some statistics here. I have it, but they're in another book. Anyway, for the first 10 people that call the office today, we're going to offer this at cost. All right, we're going to offer this at cost. So that's a huge, huge discount. I want to do my own study. I want to see how things kind of work with that. So I think the program for 3 months is just a little over $100. It's not very much. And like I said, that includes all of your supplements and that includes the plan, it includes my time, it includes everything. So if you want to take advantage of this, then you want to call the clinic, Abundant Health and Wellness, and the phone number is 281-312-2680. I had to think about that. Is that right, Trace? 281-312-2860? Okay, there we go. I hardly ever call myself. All right. So now you've got a lot of information about, what did we talk about today? We talked about the Thrive, and we talked about mammograms. So now you've got a lot of things. I just want to say thank you, Laura, for watching, and thanks, Stephanie, for tuning in. Everybody's on. So does anybody have any questions? We've got about 2 minutes, and if you'll let me know if you have a question, I'll be able to answer it. I think we've got other people coming in just a few minutes, so I can't stay on long. But if you have a question, we're here. Anybody commenting? No? Okay, guys, well, it is Friday. Have a great weekend, and I will see you next week. Take care.